1 in 3 adults are at risk for type 2 diabetes, but in Boston, diabetes hospitalization rates for Dorchester, Mattapan, Roxbury, and Roslindale were more than twice that than the rate for Boston overall. Boston's African American and Latino residents are twice as likely to have diabetes than white residents. During the next 5 years, with the support of the Boston Celtics and Sun Life Financial, the YMCA of Greater Boston plans to expand its diabetes prevention program, beginning where the city's largest Latino, Asian, and African American populations reside: Dorchester, East Boston, Hyde Park, Roslindale, and Mattapan. For every dunk made by a Celtics player during November, which is National Diabetes Month, Sun Life Financial will donate $1,000 to the YMCA's Diabetes Prevention Program, which will be matched by the Celtics Shamrock Foundation up to a combined maximum total of $40,000. Now, to tell us more about this partnership, we've invited CEO and President of the YMCA of Greater Boston, Kevin Washington. Also with us this morning, Vice President of Marketing for Sun Life Financial, Ed Milano. Welcome to Urban Update, gentlemen. Thanks for coming in.
Thank you.
Ed, let me start with you. Just talk about the mission of the Sun Life Financial Dunk for Diabetes campaign and how people can contribute.
Well, we have firsthand knowledge of how hard diabetes can be on people and how hard diabetes can be on society. You know, we're an insurance company. We know why things go wrong with people's health. And diabetes is right now the 7th leading cause of death in the country. And as your stats said, the problem could get bigger. So we just felt like we had to try to get in the way of the disease, and there was no better place to turn than the Celtics as a partner and the YMCA really as a health advocate. And that's how we started this.
Kevin Washington, exec CEO of the YMCA of Greater Boston. Talk to me about the YMCA's Diabetes Prevention Program and how these funds are going to help.
Well, they're going to help in a number of ways, because you mentioned the communities in which we'll be working in. You talked about Dorchester, and you talked about Roxbury and East Boston, where we know economically these funds will help us do these programs. More importantly, it really is about helping them change their life. It's a lifestyle change. The type 2 diabetes is a purely preventable disease. These resources will go to help the people in those communities change their lifestyle so they can avoid going into having type 2 diabetes. So that's why the funds from Sun Life and from the Celtics are so important to help these communities improve their health.
Now, we've got some promos, some public service announcements you put out there. Let's take a look at one of them. It looks like a little fun here. Let's take a look.
Hey Celtic fans, join the Celtics and Sun Life Financial this November as we raise funds and awareness for diabetes prevention. Tweet the hashtag Sunlight Dunk for Diabetes to do your part and help us reach our goal of at least 10,000 tweets. Follow us at Celtics to track our progress towards our goal of $50,000 for the YMCA of Greater Boston. Go Celtics.
Not bad, not bad. So we can chalk up $1,000 every time we see a Celtics dunk in a game for the rest of the month?
Well, actually, we just went over budget as soon as we get the next dunk. So I have to go back to the corporate coffers, as do the Celtics, and we have to figure out how to up our game a little bit, because we just hit 20 dunks, and so we're going to have to up our game. But yes, you can. And by the way, fans and your viewers can also help out. Brandon Bass gave the hashtag at Sun Life Dunk for Diabetes, and every time somebody does that, another buck goes into the program.
All right. Now, Kevin Washington, talk a bit more about the program, I guess, and about the prevention program. And excuse me, we already asked that question, but how is a neighborhood-based diabetes prevention program more effective than a hospital-based program?
That's a good question, Byron. And as we look at how the YMCA and other institutions are part of the community, we see the Y being more accessible. You ask people in Roxbury and East Boston, where's the Y? They know where it is. It's not a hospital, so it's not a place where you go to get sick. It's really a place where you can engage and get well. So that's why we see the YMCA as a place that's accessible. More importantly, there are people in there that you know. They're your friends, they're your neighbors, and collectively they work to ensure that they can continue to work together to rid themselves of this disease that we call type 2 diabetes. So that's why we call it.
Okay, Ed, why is this important to Sun Life Financial? You're an insurance company.
Well, if people are better, we're better off as a company. And we're a business-to-business company, so our clients are employers, and employers do better when their employees, basically stay well. Right now, the cost of diabetes to the country economically is $250 billion. That's medical costs, it's lost productivity of workers. I mean, we're talking about a major drain on the economy and on people's lives. But that's not really fun to talk about.
More fun to talk about dunking.
Which is why, people like Brandon Bass, pitching hashtags, and also I think why the Y is really effective as a health organization, because the Y is fun. Going to the hospital is not fun. Yeah. Going to the Y is always fun. So you take dunks and Celtics and the Y, and how could you not want to be part of that?
Kevin Washington, I guess, what should our viewers know about type 2 diabetes, the most important things?
The most important thing is that it's preventable. It's about lifestyle. And you can lose 5% of your body weight can make the difference in somebody who's pre-diabetic. That's not a lot of weight. And you do not have to be lifting a lot of weights. Brisk walking, easy exercise programs on a consistent basis, and modify your diets. Modify your diet. Easy stuff, but hard to do because we're talking about behavioral change. That's why in the Y setting, it's a group work process, and we all support one another to ensure that we reach our goals and objectives.
Now, this is the first time you've done this at the Y here in Greater Boston?
Yes.
But you've been doing it around the country. Other Ys have?
Yes.
And how's it been? How's it been going? What's the reception?
It's been very good. It's been excellent because what we've been able to show that people going through that, our average body weight loss has been like 4.9% across the country. That's exceptional for us. And in many other individuals doing this program is evidence-based. CDC, colleges, hospitals, they all recognize that this program works if done effectively.
And it looks like it's just a lot of fun.
It is. And we've been involved with the YMCA, both in Greater Boston and nationally. Actually, Sun Life contributed $250,000 so far before this Dunks program. So we're really invested. This is a continuing investment for us in the success of the program.
What's it like having the Celtics for a partner?
Oh, that's a lot of fun. Well, first of all, they're a class organization, and you can't beat that. And they do make things fun, but they're also serious about their place in the community, and we really appreciate that.
Well, with all this money going out, I shouldn't say going out the window, but going for diabetes, do you think there are going to be more dunks on the courts than you normally would see now that this is incentive?
I'm jumping up and down every game to make it do a lot more dunks. Jeff, keep dunking.
Okay, all right. Well, Kevin Washington and Ed Milano, thanks for coming in, and good luck with the program. And hope you raise a lot of money to stop a very terrible disease. Thanks for coming in.
Thanks, man.
Okay, when we return, an event to provide a safe space for young men of color to discuss the events in Ferguson, Missouri. The specifics when we return. Stay with us. We'll be right back.